Hi y'all, so I am officially 7 days post-op for my ACDF surgery, my two-level C5, C6, C6, C7 surgery. And I'm doing very well. I'm doing much better than I was day 4 and day 5. Yesterday I started kind of coming to my full self, and it was really hard to look at my house and see how filthy it was and not do anything about it. So when my husband took my kids somewhere, I can't even remember where right now, I secretly tidied up the house, and I did not relax or feel like garbage afterwards. I know I'm not supposed to do that very often at all, but so I am trying to be good today. I'm trying to fight the urge to clean my house. I did do a little bit of dusting in my room today because I'm pretty much in here all day. My third grader comes in here and I work with him. I teach him school during the day, and then I'm just in here kind of bored. I don't really watch movies and stuff. I'm not a movie watcher. I'm like a get out and doer kind of person. So that is not entertaining to me. So Netflix, all those things, it's just not real fun. I tried to watch my Hamilton, which I love, and I can watch that one play on repeat, but my Samsung Chromebook is not loud enough for me to hear the Hamilton musical, so it's not very entertaining either, which is sad because it's my favorite, and I don't have the tools that I need to hook up some external speakers to it or whatever. So anyway, enough about me. My swallow is getting better every day. How I would describe the process from day 1 to now is in the beginning, I woke up immediately out of surgery with burning behind my neck and burning going down my shoulder. Now, I was afraid that it was going to stay there, but it bothers me sometimes. It comes and goes to about right here, and I'm already feeling so much better because it only appears after I've overdone it, like cleaned something or pushed some and pulled something heavier than what I'm supposed to. I'm feeling a lot better than what I expected to be. I think the hardest part is being able to see Benjamin. In the beginning, it was really hard because he would cut his eyes away from me, and he was scared of me. Now he's getting used to me, but he does come up to me all sheepishly, and then once he does, he gets over here and he starts wanting to play with the Velcro over and over and try to take this off and then try to rip the cords off. So I'm gonna have to, after I shower today, I'm gonna redo the cords, put them under my shirt. Benjamin's my 1-year-old, by the way, who my husband is watching full time in the rest of the house while I'm kind of isolated to my room, so that I can heal properly and just be able to rest when I need to rest. And my husband is off the first month of my surgery, so I have a friend who may need the surgery, and she is really, really fearful of the surgery. And today I just had the urge to just text her and say, I am so glad that I had the surgery. Like, I know that it's a long recovery process, but I'm already week 1 in, and I already feel so much better. Like, I feel my biceps. I can feel them. Like, I can't even explain it to you how exciting that is, because for years I haven't been able to feel my muscle, and I didn't even realize that I couldn't feel it. You know, you get so used to something and it creeps up on you. The numbness just kind of creeps up on you, like so slowly and over a long period of time, that you don't even realize that it's happening to you. And then one day you're like, oh, I'm so weak, like I can't lift my 1-year-old child, like can't use my arm. And you know, it's like, but you think you're fine. You think you're fine because your arm still moves, you can still do everything. It's just you're weaker than normal. Well, I was not fine. I can look back now and say I was not fine. I thought I was up until the end. I mean, I even questioned, do I really need this surgery? Like, I told the girls when I walked into the pre-op room, I said, I feel like the bravest thing I've ever done was show up for this surgery. Because I've never had surgery before. I wasn't sure that I really needed it. And I can honestly say I feel a world better, and I am not regretting it at all. I am so super happy that I went in and had this surgery. I wish that more people were shared more positive experiences in those Facebook groups, because honestly that was the one thing that I feared the most, is that I was going to have a negative experience, because from most of the comments and things on the Facebook group was just a lot of people talking about their pain, how much pain, and I was in a lot of pain too before I had this surgery. And I just needed I needed to be surrounded by other people who've had some more positive experiences, and it just seems like there was more negatives being shared than the positives. So I removed myself from the group, and I just kind of want everyone to know that I already, 7 days later, am feeling a world better. I don't have the burning going down my arms anymore. I feel like I don't even need my Cymbalta right now. I don't know if I'll need it later, but I don't need it. I feel like I don't need it right now. I don't know that I need my baclofen. I don't really know yet, but all I do know is that I feel pretty good. Let's see. So I have a beautiful view of my backyard from my bedroom window, so I really enjoy looking out into the woods. It's hard for me to be bored, but it's also kind of nice to be bored sometimes. I am a clean freak though, and it's really hard for me to not clean my house when I need to clean my house. So, what else? I want to tell you, this is my wedge pillow that I ordered on Amazon. It's been really awesome. The day after, okay, so I came home from the hospital the next day after surgery, and I just slept most of the day. I stayed in bed and I slept most of the day. And in the morning the next day, when I woke up in my bed, my feet were really swollen, and that kind of scared me. So I thought, my husband was like, oh, you need to get up and walk around more. So we started going on walks and stuff, and the swelling went down. This was great for sitting my feet on while I laid, while I slept. And anyways, for like the first 4 nights, I slept in an upright position, kind of like flat, without my brace on. I don't sleep with my brace on. But now I sleep in between my U-shaped pillow, with it being completely flat. And I either sleep on my back with this under my, or these sides pulled close to me, or I sleep on my side with this side under my leg. The goal is to kind of just keep my everything like there's a string going from the top of my head down my back straight. So that's my goal when I'm sleeping. What else? Sometimes I am still using my round cylinder. It's right there, if you can see it? My cylinder pillow. Sometimes I use that. I just change it up sometimes because I am sitting here for a long period of time and things start getting stiff and stuff, so I have to like change my position. What else? I adore my Ivy Baby blankie from Ivy IE Baby store on Etsy. It is, I bought a bunch of mini ones for my son when he was born because I knew I was gonna have this surgery. I bought them for him as loveys, and she sent me one, a full size. I mean, this sucker would fit like a twin size bed as the comforter. It's a dream cloud blanket. She calls it a cloud blanket. And it has llama. This is ballet llama on this side. And I got to choose my pattern for this side, so it's my mama blanket. And it's like my favorite thing ever. And I probably shared about it in my last video too, but I love it so much. And all of her amazing baby loveys, I wanted my son to have something that he could hold that would be my substitute. So pretty much slept with his loveys, had his loveys on him at all times. Like, he has one right now and he loves his loveys, and the baby loveys have like ribbon for them to like teeth on, play with when they're nursing. It's just precious. So he's always had his loveys since he was brought to this earth, and now I have my mama lovey too. And it's really special to me. You start realizing just how special not only just things are, but the meaning behind the things. And the meaning behind this cloud blanket to me was Elizabeth Ivy's, her name's Elizabeth Ivy, her heart behind making this for me. So she's just a precious store owner, and she has like 44,000 sales on Etsy. And no, this is not a paid promotion. I just love her so much, and it's just so special to me, and her heart behind it. And even my sister's having a baby right now, and I'm gonna get her a full-size baby blanket for her baby with the baby's name on it. You can customize them. Anyways, so special to me, especially when you're going through something like this with the baby. You want to kind of get the baby attached to something that's their comfort. So I wanted him to have like a comfort item that we could give to him that would kind of soothe him. There'd be like a self-soother when he's not able to have me. So he's not able to have me right now. So we both have our loveys, and it's been going very well. It's been going well with Benjamin, my 1-year-old, except for the fact that he went through about 2 days, not today, but yesterday and the day before have been really hard. So day 5 and 6 were really hard for my husband with him. He was he's just screaming, like he's screaming, ah, 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 all day long. And sorry, that was someone coming in the room. My husband's like, he's doing it sort of out of just like this angst, and I can understand. His life has completely changed. He's used to sleeping with me all the time, and now he's sleeping with my husband all the time, and so everything's changing for him, and he's not able to have me when he wants me, and he's no longer nursing at all, which that's another thing. My milk, I've been taking Sudafed twice a day. I take the daytime Sudafed in the morning, I take the nighttime Sudafed at night, and I am slowly drying up, and never thought that would be a good thing for myself, but I always believed in self-weaning, like the baby just weaning naturally by himself, but this time I have to do it, kind of force my hand at it. So I am drying up, and I'm feeling not as tender as I was. I don't have any mastitis. Things are going well with that. So I feel like I talk way too much, and probably am a very boring person, but anyway, I just wanted to let you know that's how things are going for me, and I'll show you my scar. This is day 7. So, in about 3 to 4 weeks, the stitches should be dissolved. And I'm feeling pretty good. I mean, actually, he told me that my neck brace, for me to wear it, is sort of to protect myself against external factors, and just kind of to remind everyone else to be careful of me, but that if I'm being mindful and I can walk around without it, I don't have to have it when I know that I'm gonna be safe. I'm not supposed to like do any kind of extreme twisting. No twisting my head to the left or to the right really far. No up and down movements. I don't really feel that limited, and if I am going to be limited, once I'm completely fused together and everything is solidly fused, I don't feel like if I am limited in my range of motion, this release of pain and the release of all that crap, excuse me, for lack of a better word, that was stuck inside my neck, which was a combination of that posterior ligament that had ossified, turned to bone, and then also the gel that had leaked out of my 2 discs and were pushing against the spinal cord and clicking around, all this clicking around all the time, and discomfort and hurt, and that I had lived with for so many years. It's gone. My neck already feels lighter, cleaner, airier. So if I have to sacrifice a little bit of range and motion from my neck to have that release of pain and annoyance going on the inside of my neck, I will take it any day of the week. So I guess that's about it for today. This is day 7 of post-op, and feeling pretty good. I have to get my x-ray done sometime next week, and then I think I have, I'm not even sure what the date is today, but I think next week I also have my follow-up appointment with my surgeon's office. So I bring the x-ray into him, and after that appointment, I will let y'all know how next week goes. But I'm feeling pretty good. So I just wanted to bring some positivity to this kind of surgery. I know it's a very scary thing, and I was terrified in the beginning. When I found out I had to have it, I cried and cried and cried for like literally months. I was terrified of it. I was like, this is the most gruesome surgery ever. It's really not that bad. And anesthesia, since I'd never had it before, I was super scared. It was nothing at all. Like, I literally remember them putting this gas mask over me, telling me to breathe deep, and then I remember waking up, my eyes still closed, going like, is it over? Is it over? And they're like, yep, it's over. And I was like, oh, how did it go? And everyone's like, it did great. You were the perfect patient. It went well. Everything's great. And that was super exciting for me. So now just the recovery process, trying to keep myself, to keep it down and take care of myself and not overdo it is the goal. So can't wait to get the clearance to drive, and hopefully that'll be next week or sometime thereafter, but hopefully soon, because I can't wait to get the clearance to drive. I will have to drive with this on, but I'll be able to turn my body. Just get used to turning my whole body to look side to side. Use my mirrors very well, and I do have a reverse rear camera so that I can see behind me. And that's it. Get you some of these straws. And what else? Oh, the table that I complained about. This table that it leaned down. Don't even worry about it. It's not even that big of a deal. I thought it would annoy me. It doesn't at all. So, get you a table. Get you some AirPods. Get you some bendy straws. Get you a laptop, Chromebook. Get you a comfy place to sleep. Get you a pillow wedge. I haven't even had to use my heating pad because I just haven't needed it. And get you one of these amazing U-shaped pillows and a cylinder cervical pillow. They're awesome. So that's all I have for now. Have a good rest of your day, and we'll see you next week.